Hello everyone, welcome back to the channel today. So the channel today is to go through with Lee a little bit more today about what these changes related to the quality sort of improvement project we talked about in the last video will mean for our patients. So if you haven't watched the first video that we've done with Lee where he puts into context why these changes are coming and what they mean, please watch that one first because it will aid you in this video as well. So today we're going to focus on some aspects that are related to you guys and why maybe necessarily we're at the surgery encouraging you to engage with these changes. So Lee, we talked about the project was there to help with sort of triage, navigation, getting people to efficiently the right person for their problem, which is maybe more moving away from the traditional. I guess just to encourage patients, the surgery is still going to have things like personalised lists for your continuity and your doctor focus sort of care, but this is more generally about access for everyone and improving the journey right the way through. So one of the ones that I kind of wanted to talk to today was sort of the online aspect as well. So as in like things like e-consultation, which the patients can access sort of via our website. Why, as a surgery, would we be encouraging patients to, where possible, be utilising that almost as your first point of access most of the times that you sort of reach the surgery?
Well, the main thing about electronic consulting, which is the formal term, and there's various products out there that practices can use, but the process is pretty much the same.
Yeah.
It's about making sure we've captured as much information as we can in a really structured way.
Yeah.
The more structured the information, the easier it is to process at the other end.
Yeah.
So when we have a phone and people ring in, that tends to be more emergency driven.
Yeah.
Or urgency driven, I should say, and is around making sure that the outcome is probably going to be more towards having an appointment.
Yeah.
But we know that there are lots of requests that come into our practice, particularly these days, that are more administrative or not time sensitive.
Yeah.
So if it's not urgent, if it is a query about something routine, if it is administrative, if we're talking about where something's at, we want help with, well, traditionally sick notes, things like that, the Med 3 for its technical phrase. It's those kind of things. If it captures this way, one, it means that when it comes into the system at the practice, it comes in with all the structured information already tied to the patient record, which is really helpful.
Yeah.
And it goes then directly to the person dealing with it.
Yeah.
And you don't have to wait on the phone.
Yeah.
Because we don't want that coming in competing to an extent with people that have got the urgency. So this is an alternative route, allows you to do it in your own time.
Yeah.
You don't have to have any level of anxiety about talking to somebody or disclosing. You know it's going to go straight into a system.
Yeah.
But it's that structured way of capturing it. That's the important piece. And it allows us to do more with it.
Yeah.
Another piece for the practice that's really, really important is that often the administrative workload isn't captured as time.
Sure.
So we see busyness, but it's reporting on the workload sometimes can have a bit of disparity. This allows the way it's been captured for us to recognise actually the time taken to deliver on these projects as well, on these requests as well. So it means you can sit and type it, check your spelling, those kind of things, think it through, add extras, attach photos if needed.
Yeah.
But it's the highly structured way allows us to just increase the efficiency once it's in the system and give right priority to stuff that didn't need the urgency of, say, phone contact.
Yeah.
But inside the system, because it's being dealt with by the right people at the right time, actually it improves the time to deliver on an outcome as well. Yeah. So it's really good all round. And we know that we've gone to a lot of self-service electronic systems elsewhere, our utility companies, banks, etc. And we just want to know that behind this, it's still human assessed. It's still people that are behind this. So it's more about good capture, documenting the workload, being seen by the right person with the right information to deal with that specific query. We don't want to pass anybody around. There's nothing worse than that.
No.
And that actually you're more likely to get a timely result, an outcome, than if you'd have gone through the other routes, because it's set up to deal with it that way.
Yeah, and that's the messages I'm getting as well as in regards to using the e-consultation. It's just a really good tool for information gathering, and as we've already said, effectively driving where the patient needs to access the surgery. And as you say, yeah, if I have a consultation, I may get blood tests or more information so that then you maximise the time when you come and see a doctor, because we appreciate sometimes there can be waits, again, which will be triaged appropriately by clinicians. But there, you want to make the most of your time when you come to see us as well. So again, by putting these information into an e-consultation, it gives us the best option. So yeah, that's one really good one that I think is coming as well. And also just to highlight as well that if you can't fill out an e-consultation online, which we would really encourage all our patients who can to do, if you call, our trained staff will be asking similar questions along the lines in an abbreviated term of the e-consultation. And again, the same principles apply, doesn't it, as well? That's just information gathering to get you to the right person, the right time to access the surgery as well. I think another one as well is the NHS app, which I believe has quite a lot of functions on it as well.
Yeah, and we're probably familiar with the NHS app because we used it with the COVID passes. That was often one of the key features for it. But the NHS app has come a long way, and there's a lot more available within it, including access to your coded record, often being able to view results, repeat prescription ordering. That's the one. Like, I'm just going to double down on that because it lists your available medications at the time that they are due. No more having to try and remember which one it was, the white pill, the spelling of it. That's my downfall. So the ability to go in and go, I'm due it, and then you look and you can see which ones you are due on the list. It's great for tracking, it's great for just getting that request in, and again, because of the structured way that it comes in, it's dealt with much quicker within the practice.
Yeah, for sure.
Anything that removes the use of paper, verbally relaying that within the practice, we're trying to get away from that. It's about then patient safety, it's about securing our processes and speeding them up. So the way that is captured is so much better, and it allows us just to do so much more with it, and again, documenting the workload, but patients can also track the process. We're also looking at using these online tools that if something is due, like I need you to book a blood test. Not me specifically, but if you are requested to book a blood test, I can send you a link and you can choose an appointment at a time that suits you.
So bookable appointments.
Bookable appointments. And we know that when you can book them, that then you see the clarity of the date, you get reminders. It just helps improve, again, the efficiency, the utilisation at the times. We don't have to sit talking you through a week's worth of free appointments about I've got this day at this time, this day at that time. You can just see what's available to you. And when it's the routine things, blood tests, coming in for annual checks and reviews, or your flu vaccinations and things, it's an excellent way just to speed that up, put it back in the patient's control, and that time then in the practice is freed up on the stuff that's more appropriate. So that time isn't wasted. Actually, that time is better spent doing it. And that's what it's about. The patient process side of it is just so clear, so smooth. Once you've used it, you'll be like, why have we not always had this?
Yeah, and I think the feedback I've had from patients that I've look after as well as when I push them towards this as well, it has been positive as well. So I think, for our patients, it can be a scary prospect thinking about these sort of online resources and tools and things like that as well. There is support available at the practice as well. If you're unsure on things as well, we have a great IT team here that can also direct you through and just make you more familiar if that's what's holding you back. But certainly from my perspective, we've talked about the context. This is about, with the services that we've got available, with the resources that we've got available, is how we can, for the patient, make their journey efficient and deal with their problem at the right time. And these tools sound like great options, like with other sectors, like the banks, loads of things as well have utilised them well. So I think that's what healthcare are trying to catch up on. So great, Lee, thank you so much for your time over these last couple of videos. So hopefully this, for our patients, will put into context why changes are coming, and again, just the information to why we're asking you to do this. This is to improve your experience, continue good quality care. and utilise the resources we've got. So thanks very much.
Thank you.
Again, if you want to watch further videos like this as we move forward, there will be regular content being released, hopefully on a monthly basis at this time, okay, with up-to-date information from the practice, national schemes, etc. Please click and subscribe. Okay, you'll get notified by further information. If there's anything new that comes up at the surgery, we can react and send out videos such as this as well. So thank you very much for